Welcome to the V Movement, the podcast that's all about pelvic health and getting the V's in your life moving. We are your hosts, Allison Craig, physical therapist specializing in pelvic health,
and Sarah Landis, physical therapist and board-certified women's health specialist. In each episode, we delve into the intricate world of pelvic health, exploring everything from the vulva and vagina to the fascinating vagus nerve.
Whether you're looking to enhance your understanding of pelvic health, seeking advice on common concerns, or simply want to join a community that embraces these important discussions, the V Movement is the place to be.
So tune in, laugh, learn, maybe cry, and let's embark on this journey together towards better pelvic health. Because when it comes to the V's in our lives, movement is key.
In today's episode, Sarah interviews fascia specialist Bonnie Crotzer, who shares her journey of discovering the importance of fascia while dealing with injuries and chronic pain from her ballet career. Bonnie explains how addressing fascia has numerous benefits, including improved mobility, reduced pain, and enhanced overall well-being. Enjoy as Sarah takes it away.
Miss Bonnie Crotzer, welcome to the V Movement podcast. Woo!
Thanks for having me.
Yeah, we are just so honored. I've been following you for so long. And of course, through mutual lovely friends, I have gotten to just watch your career explode.
Thank you, Sarah. It's so sweet to be with you. As our connection is so deep through our dear friend Linnea. It's really fun to be here with you.
Yeah. So tell us a little bit about your work with fascia.
It all started, I was dancing professionally, mostly ballet, so quite ferocious on the body requirement level in terms of what was expected of me and what I expected of myself. So I was doing all sorts of things to try to take care of my body. I started Pilates and yoga around 15, 16, and that was very supportive, of course. But as I deepened into my career, things were getting creaky. When my knee started to hurt, I'd never had knee pain. I was like, oh my gosh, something's got to give. And in that moment, I was doing acupuncture, which all these things I absolutely love and adore and were very helpful. Acupuncture, PT, getting massage, doing some Feldenkrais Alexander technique, learning some gyro, doing all sorts of stuff to try to support my body. But nothing was really creating that sustainable change that I was looking for, and that would really support me on a whole new level of health. And that in that moment, I was dealing with lower back, that achy knee I mentioned, tendonitis in my ankles, some cervical issues. That's where I was teaching yoga, the yoga studio owner, Eddie, he passed me my former teacher, Bob's book. And I did one exercise out of Bob's book and I was like, holy smokes, this works. What is this stuff? And what the heck is fascia? I got a degree at the University of California, had 3 quarters at least of kinesiology, injury prevention. We did anatomy, and fascia was mentioned for 30 seconds one time, talking about plantar fasciitis. No one was talking about fascia at the time. I'm dating myself as well by saying this, but I started to get curious. I'm like, what is fascia, and why does working with your fascia really help change your body? And because I was feeling such ginormous changes, I of course memorized Bob's book without even realizing it. When I met his team, they were like, you memorized the book on all the exercises. I was like, I did? What? Anyways, I started integrating that into my yoga teaching practice, and I ended up at Bob's studio to train with him. I was with him and the crew for over 6 years, studying and practicing. And so it was like a huge moment personally to almost reinvent my body by working on my fascia. And so maybe I talk about what the heck fascia is.
Yeah, let's dive in.
Yeah, it was such changing this really helped me in my dance career. I felt like my body felt better than when I was 22. I was like, how is this possible at getting older at that point, mid 20s, upper 20s into my young 30s. And even now, I'm like, I still feel better than I did in my teens. Like I don't have an achy back. I don't have tendonitis in my ankles and I don't dance professionally anymore, but I do take class almost every day. I'm at technique class for ballet or contemporary or jazz or whatever my heart desire is. Um, and so fascia, and it's very normal to not know what fascia is, to maybe have heard the word, but you can't really explain it to yourself, or maybe couldn't explain it to your neighbor because it's a bit elusive. And anatomists for hundreds of years, for centuries, have been not purposely, but have been discarding the fascia, which is the connective tissue. It's the connective tissue. It's the one tissue that connects all other tissues. They discarded it because they're very interested in learning the parts. Oh, what's this stuff wrapping the heart? Let's scrape it off so we can see where the heart is. Oh, let's see what a vein is. Let's figure out what the liver is. And then they miss this material in the body, this fabric of the body, this very central organizing principle of the body that is continuous, that is ubiquitous. These are Joanne Avison's words, continuous and ubiquitous throughout our whole structure. And it really, this isn't the perfect analogy, but it's like our internal scaffolding. And it's the tissue that's really forming our form. Without fascia, we would slop to the floor. All of our parts would flop, 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 flop. We're taught that bones and muscles hold us up, but it's not true. It's this fascial matrix, a network that uses compression and tension to connect and link everything in the body. And it doesn't stop. So it folds on itself. So it does create compartments in our body. So things are also safely separated and organized. But it's like a piece of origami. There's no separation in the tissues. And we see that as you had your wonderful babes, as they were forming an embryo, they're one continuous being that keeps becoming more specific. And well, I like to think of fractals, right? It's one organizing principle is this connective tissue matrix, and then cells specify as the baby grows into a human. Yeah. So anyways, what the heck is fascia? Fascia, like I said, is the one tissue that connects all other tissues, and it literally wraps everything, impregnates into everything, is the baseline structure for everything in your body, down to permeating our bones, up to our brain matter and creating structure, even though the brain is very gushy, creating some structure for the brain, into the spinal column, wrapping the capillaries, the veins, the nerves, the bones, what did I say? The muscles, the organs. It's very much involves, it's should be considered a body-wide organ, like the nervous system should be considered a body-wide organ. Our skin's considered an organ. So certainly the fascia is, but there's reason why it's been bypassed. When anatomists are studying a cadaver, the fascia kind of loses its sparkle as the body is decomposing. But in an alive body, and folks who are listening can go to Dr. Jean-Claude Gimberteau's video Scrolling Under the Skin on YouTube, and you can get some glimmers of what a live fascia looks like in a human that volunteered to be a model. So you can see these beautiful spindly fibers that look like translucent tubules with morning dew cast upon them. So the fascia is very much hydrated. It's meant to transport the fluids in the body, but it's mostly made of collagen, which is a very strong baseline structure. It's actually made of, it forms a triple helix, with the DNA forms a duo helix, but that triple helix is a very strong binding agent. And the definition of fascia is to hold or to bind, to connect, but that kind of limits all the things that the fascia does. Besides, it's the great connector and the great organizer. as well as creating compartments, like I mentioned. It's also a transportation network for electricity, aka energy, aka frequency, current. It transducts light, it transducts sound in different amplitudes. So it's this amazing network that is supporting our body in its communication, and actually information transports faster, transducts faster, I should say, faster than the nervous system can send a message from your foot to your brain back down to your foot. The fascia is reacting in a faster format, that's cool. But there's lots of different kinds of fascia. The fascia changes based on location and specialization in the body. So purpose, the fascia in your foot is going to be different than the fascia wrapping your heart, but it's this all-encompassing connective tissue word that we're using to describe the connective tissue, but based on location, it specializes in purpose and in look and function. Fascia can be spindly, like I said, the tiny little spindly fibers linking a capillary with, let's say, a nearby muscle or a lymphatic vessel, how the fascia wraps lymphatic vessel, and then it links an adjoining capillary or a next door neighbor capillary for the cardiovascular system. Or fascia can be more structural. You think of the IT band, it's a thicker sheath. It might look like, or it looks like that packing tape that's translucent, but it has the fibers running through it. And then plus there's cross fibers on top. It's a very strong structure, and it's meant to be somewhat stiffened so that it maintains our shape. So yeah, fascia can be very different based on where it is in the body. We have fascia that connects fascia. It's called perifascia. We have more fluid fascia. Some anatomists consider the sticky part in the blood, the viscosity of the blood, to be a binding agent of as it is. So they consider the blood to be a part of the connective tissue matrix. So it's a wild west when it comes to fascia right now, because anatomists are still kind of like deciding together what's going on. But it's fun to be in this realm because lots of information to come, lots of things to unlearn and relearn. So it's a time to be not attached to what we know and just be really open to discovering.
Yeah, it just brought to mind when I was in PT school and dissecting a human and the different connective tissue that you find. Everything from each tiny little fascicle within a belly of a muscle to the actual, then there's different names for all of the different levels of musculature, and all of it is surrounded by another layer of fascia or connective tissue structure. And then so it's just like layer upon layer, and it's amazing.
So amazing. It's so cool. It's like a piece of citrus. If you cut it in half, you had the fascia that's wrapping the whole muscle group.
Yeah, that's a great analogy.
Have, like, the individual slices of the citrus, that would be like the individual muscles being wrapped by the fascia. But you're right, down to every single muscle spindle, there's another layer of fascia, like those little lobules inside the citrus filled with juice. That's what fascia is. It's fractal. It goes from big to small, or small to big, however you want to think of it. And it really is that continuous. So that's so cool. What an honor to get to dissect, right? I got the opportunity to do that as well. And it really blows your mind of
and gives you such an appreciation.
Yeah, how majestic the body is, and also huge gratitude to the folks that donate their bodies so that people can learn. It's really a phenomenal thing. I'm going to do that with mine, not to get morbid.
Not morbid at all. That's a gift. That's a gift.
Yeah.
That's 100% a gift. Yeah, for sure. All right. So now we understand a little bit more about what fascia is. Yeah. How do you use it?
How do we use it? It's using us. No, I'm just kidding. We're using it. It's using us. The fascia is something to be playful with. I think that we have this idea, at least in social media and some of the not so great wellness world, says fascia is a disease. I'm like, who's saying this? This is not what's happening. It's actually like our most foundational structural aspect of us. So someone's got that wrong. But fascia, because of our life, just what happens in life, we have accidents, we make repetitive motions, or we don't move, or we had an accident, or we have some sort of trauma, etc. It seems to me that the fascia can get densified or disorganized or adhesed in certain area, like that one knot you've had in your shoulder your whole life. That's a myofascial issue, muscle and fascia mixed together. And what I teach is I teach people how to pendiculate, which is just what animals do. So you know how you've seen an animal on the ground that kind of like yanks on the ground and it's moving its body a little bit here and there. We do the same thing when we yawn. We pendiculate, what that means is to engage your tissues as you elongate or as you move a little bit here in space. So when we pendiculate, we actually engage the fascia on a different level than we would if we're doing a more traditional passive stretch like I learned in ballet or I learned from yoga, etc. And we go to the end of the range, we stay, we breathe, we try to relax. This is an active form of moving our tissues. And by doing that, we can start to gently internally exfoliate. It's also not a perfect analogy, but it's along the right idea of starting to support the tissues to gain more circulation, more glide and slide, wake up, amplify your already innately, inherently intelligent body to nudge the cells to be like, oh, we're cool. This area feels healthy. It feels safe. We don't need to hold on to this hardened tissue, which that's just what happens in life. So we can come into this arena in a playful way instead of, I need to go after my fascia. I need to go after my body and fix it. Instead, we're being with the tissue, but this engagement that I'm talking about heightens our awareness. It heightens the consciousness and it heightens the actual biomechanical. I don't like biomechanical as a term, but just so we're all landmarking on the same page, it heightens the biomechanicality of the tissues. Yeah, because we're not machines, but that's our current term until we culturally shift that game a little bit. Yeah.
Yeah. And it gives like the lusciousness back to tissue, especially during that perimenopause, menopause, postmenopausal age, where our collagen fibers actually change because of different hormone stimulations. So by moving them and sliding and gliding in a certain way, it gives some of that like pizzazz.
Ooh, I like that. Pizzazz. I usually say gushy, so I'm going to take pizzazz and snag that from you. But yes, the technique that I'm teaching, I borrowed information from Bob. I borrowed information from all my movement practices. And what I teach is called fascia flossing. And it literally is like a gentle internal exfoliation of the tissues, like I meant before. But you're right. And the aim is to help the tissues be the most pliable, functional, elastic, hydrated form that they can be. And yes, like over time, especially with hormonal changes, we need support in that. Versus our traditional practices, like I mentioned before, the aim isn't necessarily to have super healthy tissue, although we hope that's a byproduct of our movement practices. What often is happening, the goal is to go further, to get to a destination. Like I want to touch my toes. And that's not what fascia flossing is. We try actually to not go in extreme ranges or ranges outside of functional, because we're really just aiming to make the belly of the tissue nice and healthy and keep the joints really safe and stable. Because oftentimes stretches or anything on Instagram, it's go to the end of your range and try to go further. That actually can cause some destabilizing in the joint structure. And we actually want our joints to be solid and supportive. But the surrounding tissue, like I'm pointing to my shoulder head right now, the surrounding tissue of the bicep, the delts, the pectoralis, the trapezius. We want all those tissues to be super gushy and functional, meaning that it can elongate, twist, contract, shout, do all the movements it needs to do, not just go into the splits or whatever. So yeah, that's the aim of fascia flossing, is to have super healthy tissue, and not necessarily to put us in a perfect shape. But what happens when we fascia floss is that our joints become more suspensatory. So we have a little bit more support in our joints. We have more access to strengthening our tissues, because if you think of, let's say your trap is super dense with accumulated fascia, then it's going to be hard for that muscle to contract. So the trap is almost tourniqueted by the fascia or blockaded. It's like a McDonald's taking up the real estate of an organic restaurant. Bob used to say that. I love that analogy in a stupid way, but we want to floss the tissue first, and then we'll have more access to strength training that area. So a place that you've been trying to strength train, like a lot for women, is triceps, at least for me. That I have more dense fascia back here, as most women do. Actually, it's a normal pattern in a female form. I got to floss my triceps first before I do my tricep curls, because otherwise the fascia is blockading in a way. So that's one of the points of fascia flossing, besides the healthy tissue, the ability to strength train. The increase of circulation equals more oxygenation, more waste removal, and more reception of nutrients. So as we decrease the density of the fascia in certain areas that might be more blocked, I was going to say blockaded. No, just wanted to say blockade so badly. The areas that might have been blocked, like a kinked garden hose, right? You wouldn't water the garden with a kinked garden hose. You'd untangle it first before you water your garden. Unkinking those areas, de-densifying certain areas, is going to increase our functionality overall. And what happened for me when I started this is it wasn't just biomechanical upgrades, like my tendonitis in my ankle went away, my knee stopped hurting, my neck got so much better, etc., etc. It was a change in my hormonal functionality, which was huge for me, and immune system. That was my biggest just overall dysfunctionality. I had just like a wrecked immune system from too many antibiotics as a child. Sinus infection girl right here. And as well as digestive support. That changed my lymphatic system. Then when the lymphatic system's working better, then everything's working better. That's the fun part about fascia flossing, is that you're not just structurally supporting postural changes, functionality changes. You're also getting just a whole overall well-being upgrade.
So relating that back to, there was a couple things I heard in there. One of them was digestive system aid, and just supporting all of that. So much of that, right, ties back into that pelvic floor and pelvic floor functioning. Just wanting to support all of those different structures. And if that fascia is super binding, especially around the large intestine, can cause a lot of issues with bowel movements. So that's something that I see very frequently in my clinic.
Oh, wow.
But you've done a lot of work with fascial flossing and the pelvic floor.
Yeah, I'm not a pelvic floor therapist by any means, like nowhere near your expertise, but I do work with some pelvic floor therapists hand in hand to help folks with more of the postural setup of the pelvis. And that seems to really aid the pelvic floor therapists in making more grand changes for their tissue, especially if they're doing hands-on manipulation, and then also having more functionality, having access to strength training their tissues too. So that's been really fun journey the last few years, discovering what's going on with that and playing with fascia flossing and how it can support pelvic floor PTs or just folks in general with pelvic floor health. But a big thing that we see, and I'd love to hear your thoughts, Sarah, is that when the pelvis is hyperflex, meaning you have an extreme anterior tilt of the pelvis, that means your low back is feeling a little crunchy and your tailbone's pointing backwards, just so we're all on the same page. When we have a deeper S curve in our low spine, it's tilting the pelvis forward. That actually compresses all of our, especially anterior organs. The bladder doesn't have as much space, the uterus, of course. And when we have less space, in quotes, there's no space in the body, but there's compression or suspension because everything should be hopefully vacuum sealed except for your digestive tract, which can have air in it. But otherwise, your pelvis is tilted too far forward, you're compressing those organs. So that doesn't help with anything, including elimination, of course. So I help folks with changing their hamstrings, which sometimes we have very hypermobile hamstrings where we can do a full forward bend, but it doesn't mean our hamstring tissue is flexible at all. But when we create true flexibility in the hamstring tissue, can pull the pelvis into a more neutral position, your personal neutral, right? Everybody's neutral. We still want a curve in our spine, of course. Your personal neutral, just line up the pelvis a little bit easier so that there's more space, one, for the organs, but two, so there's less strain on the actual pelvic floor. Because when we're dipped backwards, we're always in this stuck long shape. That's pulling on the psoas. So we have less support from the psoas. And as we start to neutralize the pelvis, and everything seems to be working better. So that's one thing that kind of, these are just general patterns that I see. And then the compression of the pelvic or the outer pelvic tissue. So the tissue on the outside of the pelvis can also become quite dense just from life. Could have had an accident or whatever it is, but it smushes the pelvic bones more narrowly. One, that disrupts the sacrum in the back. It gives it less space for it to settle into kind of like a flat, more comfortable spot that it wants to be. And two, it's the same idea of giving your hip joints and all of your tissues, your organs, the fluid flow in your lower realms more functionality because you're providing those spaces. So that's the main thing. And then we have the inner thighs. It kind of relates to the outer hips, is the inner thighs, changing the quality of the tissue, because we tend to hold a lot of tenseness in our inner thighs, especially in our culture. Let's cross your legs, hold everything. That goes into the esoteric and the cultural social. But your gracilis, your inner thigh muscle, links right up into your pelvic floor and it's branching into and continuous with our clitoris, which is amazing. And so the Chinese medicine folks, I love to study Chinese medicine, so freaking brilliant. It's insane. They used to say they observed that the liver channel, which runs up your inner legs, is associated with being free or not free, repression or not repression, being stuck or not being stuck. And that inner thigh tissue, the gracilis muscle itself, is linking right up with the clitoris, right up with the pelvic floor. So creating some easefulness in the inner thighs and changing the health of the tissue in the inner thighs, I think also decreases the tenseness that we can hold in our pelvic floor. Those are just like a couple general things.
Yeah. So I'm loving all of this. Yeah. So even with the gracilis fascial connection with the clitoris, if you're able to work on those adductors, like you're saying, in the middle of the inner thigh, I have had many patients report improved orgasm, clitoral orgasms, right? Just because they're able to, as tissues move, they need to, as you're saying, contract and expand, but also strengthen and tighten. They have to slide and glide. And if they're stuck, like you're saying, in any way, then you're not getting that. And so much of the time, and if you've ever been in my clinic, everyone, you know that I've talked to you about this, it has to breathe. But that's basically the same thing that Bonnie is saying, is that everything has to have this fluidity to it. And if your pelvic floor and all of the surrounding, even if your big toe, like it's all connected, and it's because of that fascial connection. If your big toe is really stuck, you might be having pelvic floor dysfunction. So let's work on that big toe. But you were saying working on the inner thigh can help depending on what's going on with the pelvic floor with orgasm. But even like you were saying with a hamstring mobility, all the time do I say squatty potty, right?
Body, body.
It's a game changer.
Really
Or
is.
we live here in Humboldt where you can just pee or poop outside without anyone watching, bury it, do all the proper things. But right, the whole idea is if you can get into that tilt, not the anterior tilt, but slightly more into that neutral or posterior tilt, you're giving those organs that much more space. And that's where the fascial component is so important for all of these like literal daily functioning activities. We need this.
Talk about continuous tissues, right? How wild, like our big toe connected to, well, in Chinese medicine, big toe is spleen channel or spleen pancreas to some, runs up the inner leg and goes right into the uterus zone too. Yeah. And I think also, yeah, praise the Lord. This stuff helped my orgasms. Like I'll put myself out there. I want everyone to have gorgeous, beautiful, full experiences that way. But your organs also want that functionality in terms of hormonal health. We have elimination, like you said, healthy bladder. I used to pee all the time, and now I can hold my pee because I have a more functional pelvis overall because of this. So it's really brilliant work that you're doing to help folks. It's really amazing.
You as well. Are you kidding me? This is like literally the connecting component.
The link. Here we are with the link. There's a great video by Gil Headley, and I think maybe you need to be a member. He's a brilliant fascial anatomist who was a theologian. So am I saying that right? Yeah. That turned into an integrative anatomist. And he has an amazing clay model where he puts the pelvic floor together with all these that demonstrates all the parts that form our pelvic floor. And it's so neat because we all have this visual that like there's just this shaft built into us that is the vagina, but it's all the different component parts that build up that shaft. And I think if we all got a little curious, if you are curious, learning just those little things can really help us. One, the curiosity leads to wonder. It's, oh my gosh, my body is built like that. My body does those things. And that wonder leads to self-love, and that self-love leads to more personal care, I think. I love
and personal connection too.
Yeah, and personal connection. And then connection to your partner. If you have personal connection, you have more connection to your partner and more pleasure. Yeah. All of this is just like really good stuff. And I think if we started learning about our organs as kids, what if we were doing organs instead of ABCs in kindergarten? Kids are learning that. Lynette, our best friend Linnea, her kids already know how to write and spell. They're freaking 4 years old, or they just turned 5. They're going to turn 5 in a month.
They're going to turn 5. Yeah, July.
And I'm like, what if we start learning like, oh, my large intestine scoops up my poop and lets it go? Like kids will be so excited. And then we actually impregnate into those ideas into them at a young age. And then we walk forward in life with, oh, wow, my body is a miracle. I am a miracle because I am my body. And yeah, anyways, so fun.
It's so fun. It's so fun. But that's why we do the work we do, right?
That's it.
That's right. That's right. So tell us more about where we can find you. How do we take one of these fascial flossing courses?
Yes, I'd love to have you all. I'm on Zoom twice a week. I know for the California kids, it could be a little bit early. We're 9 a.m. on Mondays Eastern time and 10 a.m. Eastern time. So you have to do the 7 o'clock one if you can, one Thursday. Sarah always be my guest, of course. But if you aren't joining live on Zoom, if you want to join as a member, you get access. I think I have 150 some videos that help you problem solve different areas of the body. We have a whole section devoted to the pelvis. It's called the pelvis department. And so there's a whole video series on that. There's a stress relief video. There's a help me sleep video, et cetera, et cetera. It's the works. And if you have a request, I'm always open to making a new video for everyone. So go to thefloss.com, become a member. It's only $38 a month. It's nothing. It's one yoga class in New York City. And you can discontinue use at any time. You can also find me on Instagram at Fascia Department. We have lots of free information there. And there's some free content on YouTube because I really do want this work to be accessible to everybody. If you're in New York, I'm at Sky Ting Yoga twice a week, live in person. I'd love to see you. And otherwise, we're retreating around the world with Linnea and Colleen, beautiful Nomad crew, which Sarah, you have to come.
I have to come. I want to come so bad. You guys, so they're doing these retreats that have like really taken off. When did you first start those?
Oh my gosh, 2018. It wasn't that long ago, but we did Telluride was our first one. We literally had more working people than people joining.
And participants.
But now that's not the case, I promise. We made our way in the world.
Oh my gosh, they are all over the world. You just hosted one, right?
Yeah, we just did Molokai, the small island in the Hawaiian chain, and then we're off to Puglia mid-September, which is so fabulous. Yeah, we're
such a dream.
Yeah, so
these ladies, I can't even tell you, work so hard on these retreats. I'm always like, what is going on? Talking in the middle of the night, emailing, texting. I swear it's when they get their best work done. They're nonstop, that's for sure.
It's amazing. I mean, Linnea's doing so much of the coordinating, praise her. And Colleen comes in with a whip with her Pilates, and it's the most fun. And it's definitely a pelvic floor safe version of Pilates. Colleen really makes sure that we're in neutral. So
yeah. No, she's amazing. She's amazing.
Yeah.
Oh, you have so many amazing things going on, and I can't wait to dive into all of them. And thank you so much for being our guest on the V Movement.
Oh my gosh, thank you for having the V Movement. Let's keep it moving, and many blessings to everyone's body. I just want everyone to feel fabulous. So appreciate you having me, Sarah. Can't wait to see you in person soon.
I know. It'll be great. It'll be great. Thank you.
Thank you for listening, and we hope you learned something new about fascia. You will find all of the important links in the show notes. If you haven't already, please subscribe to the podcast and follow us on Instagram at thev.movement. Thank you so much for listening, and remember to keep the V's in your life moving. And continue to listen for our disclaimer. The information shared in this podcast by Sarah, Allison, and our guest interviews are intended for educational, entertainment, and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. While we are a licensed physical therapist, we are not your personal physical therapist, and no patient-provider relationship is formed. If you have any health concerns or questions, please consult your medical provider. The information on this podcast or any of our platforms is to use at your own risk.